Good morning, everyone. Today, we are tackling one of the most proactive questions in all of public health. Do people choose their own health? Again, the question. Do people choose their own health? It sounds simple, but as you will see, the answer pulls us into biology, politics, economics, and even mortality. By the end of this chapter, you will understand why modern public health is so much harder than it was century ago. Let's begin by setting up the three key terms that anchor this chapter. There are three terms I want you to hold into throughout today's lecture. Number one, prohibition. Number two, regulatory approach. Number three, social norms approach. Don't worry about memorizing definition yet. Each will become clear in context. Sorry. Just notice that all three are about the same underlying tension. How much should society intervene in an individual's behavior? Keep that question in mind. With that framing, let's go back to where public health's success story began. Public health has always had one core mission: to prevent death and disability. And in its early days, it succeeded by being very focused. It would target a specific disease, hunt down its particular cause, and then find a way to break the cause and effect chain. This was a beautifully logical, almost engineering like approach, and the 20th century proved it worked, especially against infectious diseases. Let me show you exactly how that chain breaking worked. In this slide, there is a mechanism. Talk about the mechanism. Public health professionals learned to break what we call chains of infections. The most common move was to remove the etiology agent, the bacteria, virus, or parasites, from the environment, usually from water and food. Think clean water and safe food handling. The other move was vaccination, immunization, the potential host before the agent could ever reach them. Two clean strategies, enormous payoff. But there is the turning point. The disease is changed. Let's see what happened. The shift to chronic diseases. As infectious diseases came under control, chronic diseases stepped into the spotlight as the leading causes of death and disability. And there is the problem: chronic diseases are far messier. The top killers today have complex causes and usually no single etiologic agent you can simply remove. There is no germ to filter out the water. Despite decades of biomedical research, we still have no vaccine or environmental fix for most cancer and heart disease. To really feel this shift, let's look at the actual data. We will start with the first of 1900, then 2017. Look at table 1. This is 1900. Look at the top of of, of the list in this table. Pneumonia and influenza, tuberculosis number 2, and diarrheal disease, all infectious, together nearly a third of all death. Heart disease is down at number 4, cancer at number 8, diphtheria, a disease most of you have probably never seen, make the 10. This is a world dominated by infections. Now, let's fast forward over a century and watch the list transform. Table number 2, here is 2017, year 2017. And notice how the whole picture flips. Heart disease is now number 1 at 23% of all deaths. Cancer is number 2 at over 21%. The infectious disease that ruled in 1900 have largely have largely vanished from the list. There was no not in the top 10. Influenza and pneumonia have slipped to number 8. Now we see Alzheimer, diabetes, and even suicide appearing. This is a completely different challenge. Let me put the two lists side by side so the movement is crystal clear. So comparing 1900 versus 2017. Top 3 killers of 1900 were all infectious in origin. The three biggest killers of 1900 were all infectious: pneumonia, influenza, tuberculosis, diarrhea, as I mentioned before. And they have moved down or disappeared entirely. Meanwhile, heart disease climbed from fourth to the first in 2017. And cancer rose from 8 to second. So public health did not just win a few battles, it fundamentally reshaped how Americans died. But that victory created a new puzzle. And in 1900, a group of experts decided to look at the data in a totally new way. A new way to look at the data. 1990. In 1990, a group of CDC experts has insight that I want you to really sit with. They said the leading causes of death we list are not actually root causes at all. They are just the diagnosis written on the death certificate. Heart disease, cancer, those are in the States. They result from a combination of inborn, largely genetic factor and external factor. So, the experts ask a deeper question: what's underneath these diagnoses? That question gave birth to powerful new concept. So defining actual causes of death. They set out to identify the underlying non-genetic factor behind each leading disease. And they called these the leading actual causes of death. Now, these tables that I show you are estimates based on the best available data. So don't treat them as precise, but they matter enormously because, unlike genetics, these factors are preventable, and that makes them targets for public health intervention. The analysis was repeated in 2000, in the year 2000, with new data, and the order barely changed. Let's look at that 2000 list. Here the table number 3 in 2000, the actual causes of death. And be sure that all the tables in the United States, the data. Okay, here's the list that should reframe how you think about death in the United States. The number one actually caused the tobacco, close to half million deaths, about 18% of all deaths. Number two, poor diet and physical inactivity. Third, alcohol consumption. The microbial agents, toxic agents, motor vehicles, firearms, sexual behavior, and illicit drugs use are ranked from number 4 to number 9. And notice the asterisks here in alcohol consumption. Alcohol related crashes are double counted in both the alcohol and motor vehicles categories. So be careful adding these up. Now, this is from 2000. Let me update you on what's changed since. Recent updates to the ranking. More recent studies suggest that poor diet and physical inactivity have likely overtaken tobacco as the number one actual cause. That said, tobacco was still the leading cause of disability adjusted life years as of 2016. And that term, DALI, just DALI means disability adjusted life years. This is the abbreviation of the DALIs. Just means the total years lost to poor health, disability, or early death. Meanwhile, illicit drugs use, especially opioids, shot up around 70,000 deaths in 2018. But the big three, tobacco, Poor diet and physical inactivity remain at the top. Let's now go through these causes one by one. I will start with tobacco. So, the tobacco number one, according to the data in 2000. Tobacco earns its place at the top. It accounts for 30% of all cancer death and 21% of cardiovascular disease death. On top of that, it drives chronic obstructive lung disease, infant death from low birth weight, and even burns from accidental fires. And don't forget the the bystander of those close to half million deaths. 35,000 came from second-hand smoke. By 2014, the total had climbed to close to half million deaths and 41,000 from second-hand smoke alone. Now, let's move to the other factor that may have overtaken it: the poor diet and physical inactivity. Poor diet and physical inactivity sit right at the top with tobacco. And notice there is listed together because together that I mean poor diet and physical inactivity because they are so tightly linked. Overeating plus inactivity equals obesity, and obesity, dietary fats, and secondary living are tied to heart disease, stroke, several of cancer, and diabetes. Death from this factor rose 22% between 1990 and 2000 estimates and kept climbing. By 2016, dietary factors alone were linked to over half million deaths, and obesity prevalence has been rising dramatically since the 1990s. But here is where it gets interesting. This number became genuinely controversial. The, the 2005 obesity controversy. In 2005, scientists from CDC and National Cancer Institute challenged the earlier obesity calculations using different statistical methods. They concluded something surprising. Being moderately overweight might actually be proactive, especially in older people, though full obesity still caused premature death. Predictably, this delighted critics of what they call the health police and libertarians who resent being told how to live. And honestly, it wasn't clear why this analysis differed so much from the other. So the researchers went back to check their work. So, revisiting the obesity findings 2010 and 2013. In 2010, troubled by contradiction, the original researchers reinvestigated. They tested whether the result was an artifact, maybe sick people losing weight, or smoking confounding the data, and found neither explained it. They stood by their 2005 findings. A 2013 review agreed moderate overweight is not harmful, but obesity is linked to higher mortality. The strong evidence remains that obesity raises the risk of heart disease, diabetes, hypertension, and some cancer. One theory for the puzzle: medical care has simply gotten better at preventing these deaths. Public health still treats excess weight as a major threat. Now, the third actual cause, alcohol. So, alcohol in number three of the percent of all death. Misuse of alcohol, the third actual cause. Alcohol comes in third, as I mentioned in the table. It behind 35 to 40% of motor vehicle fatalities, plus chronic liver disease, cirrhosis, home injuries, drowning, fire death, job injuries, and 3 to 5% of cancer death. And underage drinking deserves special attention. For those under 21, it's linked to impaired driving, fighting, poor school performance, sexual activity, and smoking. Excess underage drinking cause more than 4,300 deaths a year and more than 119,000 emergency room visits among youth age 12 to 21. Let's move down to the list to the number 4, microbial agent. Number 4 is microbial agent. And here's a lovely irony. This single category contains the top 3 killers of all 1900. The fact that they have fallen this far itself a, a moment to public health success. But, and I want to stress this, infectious disease are not conquered. Under the right condition, they could climb back up this list. Keep that humility in mind. Number 5 takes us into environmental health. So, toxic agent is the number 5. Here the toxic agent land at number 5, and that relatively low position reflects success in environmental health here in the United States. But the research flagged this as their most uncertain figure. Environmental threats may actually belong higher. And the picture differs dramatically by country. In the former Soviet Union and in China, where environmental health has not been a priority, pollution is a far bigger killer. Now, let's group the remaining behavior causes together: motor vehicles, firearms, and sexual behavior. These four round out the list. One methodological note that matters: many deaths have multiple causes, so the researchers had to choose the most significant one. For example, most AIDS deaths were attributed to sexual behavior or drug use, even though technically microbial agent is involved. Encouragingly, death from these causes dropped since 1990. Human immune deficiency virus HIV treatment improved, and alcohol related crash death fell thanks to stronger drunk driving enforcement. But one of these categories has exploded. Let's look at it. Illicit drugs use, the largest relative movement. Illicit drugs use shows the single largest relative jump on the list, driven by opioids, but also cocaine. Overdose death surged well past the old figures, over 69,000 in the 12 month ending February 2019. And the causes are complex and deeply rooted in economic and social change since the 1970s and the growing availability of stronger, longer acting painkillers since 1990s. So that completes the nine causes. Let's step back and see what they add up to. Together, these nine actual causes account for roughly half of all death in the United States. To other half, genetic factor, which were deliberately excluded, plus less identifiable causes. The researcher also flagged lack of access to health care as significant, something of Affordable Care Act was meant to address. If it survives its critics, and of course, some deaths are simply old age. So why obsess over these nine? Let me explain. These nine matter for three reasons. The reason number one, they cause premature death. Reason number two, they are often preceded by a long decline in quality of life. And reason number three, crucially, many are preventable. Now, here is the K division. This is the end of the part one of this chapter. See you to complete the second part of the same chapter next lecture. Thank you and goodbye.